Good afternoon or evening, guys. I just want to give a brief PowerPoint presentation on the use of medical terminology and why it is important. My name is Rachel Dunlap, and I am currently a nurse. I work as an LPN, and I'm currently studying healthcare administration at Colorado Christian University. During this slide, we're going to address a couple of things. First, we're going to address what medical terminology is, how we use medical terminology to prevent medical errors and medication errors, how to communicate better, how to learn from others, and how to apply what we have learned. Medical terminology is described by Carl Cerny as a language, but also a type of code. Its main use is to convey information in medical context to achieve a computer or machine-like form of communication free from errors and miscommunications. We must be careful to use proper terminology and not confuse lay terms with actual descriptive and factual terms. Common medical errors and how to prevent them, and how medical terminology plays a part. We don't want to make medical oops. So medication errors are one of the most common medical errors. In fact, studies have shown that out of 10% of errors that occur during a hospital admission, 60% of those errors are medication related. Whether it is a breakdown in communication or it's an error originating from the prescribing physician, an error of communication from the physician to the pharmacy, or an error that's made during the administration of that medication. The important part is we identify it and we correct it. At any point in the administration process, there's a potential for the breakdown of communications. This is why medical terminology is used. For example, the physician prescribes a patient ibuprofen, 800 milligrams, 1 tablet, POTID, PRN. Now, for the lay person, this probably will seem like Greek. However, to medical professionals, these are very concise directions. These directions are as followed: ibuprofen, 800 milligrams, 1 tablet by mouth, 3 times a day as needed. This is for the pharmacist as well as the nurse or staff administering the medications. Steps that we can take in preventing medication errors. A lot of hospital facilities or other medical facilities such as skilled nursing facilities and nursing homes have policies and procedures, but there are 8 what we call rights of medication administration: right patient, right medication, right dosage, right route, right time, right reason, right response, and right documentation. We want to make sure that we're giving it to the correct patient. We want to make sure that we're administering the correct medication at the correct dosage and in the right route, whether it's by mouth, by IV, by injection, or rectally as a suppository. We want to make sure that it is given within a timely fashion. We want to make sure it's given for the right reasons. We don't want to give somebody with low blood pressure a blood pressure pill resulting in a drop in their blood pressure further. And we want to make sure that the patient has the right response and that we document it accurately. If an error occurs at any point in this process, it is important that we stop, identify the error, and document it so that we can prevent it from happening again. The first thing we want to do is we want to take responsibility for our actions. When an error occurs, whether by your own actions or by the actions of others, we must hold ourselves accountable as well as those that are around us. One of the 3 steps of accountability is admit it. Admit you made the mistake. 2, own it. Own up to that mistake. Admit to yourself, and then admit to your superiors that you have made the mistake and take the appropriate steps to correct that mistake. Remember, denying your accountability does not make you any less accountable. You are responsible for your own actions. Maya Angelou once stated, "I've learned that people will forget what you've said, people will forget what you did, but people will never forget how you make them feel." The next step in this whole process is the importance of communications. I like this little comic here. It looks like they dropped the patient, and the one staff is speaking to the others and said, and that's why we lift on 3. And communication is important. We do not want there to be harm in any way. In order to have good communications, we must understand that not everybody has the same knowledge, education, or understanding that we do. We cannot simply expect everyone to react or understand in the same way that we would. They are not us. If we are unable to understand or realize that not everyone thinks the same or understands things in the same way, we are setting ourselves up for failure, miscommunications, and medical errors. This is where medical terminology comes into play. It gives medical professionals a common language in which to communicate accurately with one another. However, there can be a difference in how it is used within each department in a healthcare facility. For example, a professional nurse uses his or her knowledge about what they know and do to communicate facts, ideas, and questions about nursing. A nurse will use medical terminology in a descriptive way, whereas a physician would use it in a diagnostic way. And that's just a little understanding there of we all use medical terminology in the healthcare setting, but we might apply it in different ways depending on the job we are performing in that setting, whether it's a physician, a nurse, an administrator, billing, registration. It all is important. It all plays a part. So how can we learn? How can we learn from others? How can we increase our knowledge and apply what we have learned appropriately and effectively? In the Bible, we read in Philippians 4:9, that God told us, to take what you've learned and received and heard and seen in me, practice these things, and the God of peace will be with you. Well, if you take what you've learned, you receive it, and you apply it, you can have the peace of the knowledge of knowing that you have done everything in your power to ensure that the care of your patients or your staff has taken priority, and you have not caused any harm in any way. The last thing we want to do is cause injury to someone or make a serious mistake. We can prevent making these mistakes by forgetting our own arrogance and learn from those that have more experience and education than we do. How do we learn from others? First, we ask questions. If you don't understand something, ask someone that does. If they don't understand it, find someone that does. Don't be afraid to ask questions and ask for help. 2, use additional resources. There is a plethora of knowledge out there at your fingertips, whether you get onto the internet or the interweb or your hospital or facilities database, or whether you pick up a book. There is help out there. There is additional resources that you can use. 3rd, give advice, listen when given advice. Never assume that what you know is the ultimate or the only way to do it. Person that is giving you advice usually knows what they're talking about because they have learned from experience. Continue your education, and always remember you will never know it all. Lastly, we want to take everything that we have learned and we want to apply it to our future positions as healthcare administrators, as healthcare administrations. We want to take steps to communicate effectively and efficiently, offer incentives to increase compliance with reporting any medical mistakes, encourage staff to increase their education, make asking questions less taboo, and ensure that all staff is recognized for the important part that they play, not only in patient care, but also in everyday workings of the healthcare facility. Take steps to communicate effectively and efficiently. Never assume that people understand what you're saying. Make sure that it is understood and that there's no questions. Offer incentives to increase compliance with reporting any medical mistakes. Make it okay for people to understand that they are human, they're going to make mistakes, and to ask for help. Encourage your staff to increase their education. Let them know that it is okay to want to better themselves or increase their knowledge. They're not going to be punished for wanting to advance in their career. Make asking questions less taboo. Make them understand that it is okay to not know everything and that it is okay to ask questions. And lastly, ensure that all staff is recognized for an important part that they play. We, as healthcare professionals, need to work together. It is not the administration against the doctors, or the administration against the nurses, or the nurses against the doctors, or the nurses against the pharmacy, or the housekeeping or dietary. We all work together to make things flow. We are human. We're going to make mistakes. But if we can work together and everybody is made to feel like they're an integral part of the facility and how it is run, they are more than likely going to work at their best and achieve their best. I hope this slideshow was informative. I hope I didn't go too fast. I have a tendency to ramble sometimes. And on the last page here, you will see the references that I've used in my presentation here. These are all wonderful references. I encourage you to look them up, read them over. They're very informative. Thank you. Have a good night. Thank you for watching.